Hi, this is Stephanie Bolton with Healing Sounds Music Therapy, and in today's video I wanted to talk to you about music therapy as a treatment form for maternal mental health issues. So maternal mental health is increasingly discussed these days, which is a good thing because that means you have most likely heard of postpartum depression, and you probably even know someone who has dealt with postpartum depression or an anxiety disorder. But if you haven't, then postpartum depression is a kind of depression that happens after childbirth. It could also happen during the pregnancy, but that's called something else. What you may not know is that expectant and new parents are also at risk for some anxiety disorders. Because these conditions can also occur during pregnancy, as I mentioned, perinatal depression or anxiety is a much more accurate term than postpartum, because perinatal includes the entire pregnancy, childbirth, after childbirth time frame for moms and dads. Perinatal anxiety conditions can include general anxiety disorder, a panic disorder, PTSD, and obsessive compulsive disorders. Unfortunately, there's not a whole lot of research on perinatal anxiety conditions compared to postpartum depression. Postpartum depression historically has just gotten a lot more press and a lot more attention than the perinatal conditions have gotten. But what we do know is that there's an increased risk of anxiety in the times surrounding childbirth. And some research suggests that a rate of about 16% of postpartum mothers and 10% of postpartum fathers can experience that kind of anxiety. And these are similar rates to those that experience postpartum depression. So it just seems to go hand in hand that many anxious parents are also depressed parents. However, that's not always the case, and it's important to recognize the perinatal anxiety as a distinct condition from postpartum depression. So what do you really need to know about that? Most cases of maternal mental health disorders are not primarily caused by hormones. That's a myth that needs busting. These conditions are usually linked to a previous mental health history. So for someone who's maybe already struggling with depression or anxiety or has a previous diagnosis of those things, they have a higher likelihood of having those occur during pregnancy. So how does it affect your child? It's an excellent question. These conditions can have consequences for child development, but fortunately effective treatment can lessen or prevent the negative consequences to the children. But most parents don't seek mental health services because they might think that their symptoms don't match what the textbook says postpartum depression or anxiety should look like. Maybe they feel like their symptoms just aren't severe enough to warrant going to see a professional. But increased awareness is important for helping people to find and receive the mental health care that will be effective for them. So how does music therapy fit in to this picture? Well, music therapy can provide opportunities to explore your personal feelings around childbirth, around postpartum, the time period postpartum. It can help deal with self-esteem, give personal insight. It can help make positive changes in your mood and your emotional state. Extremely important, in my opinion, is that music therapy can help you have a sense of control over your life because it's a successful experience. It can give you tools that you can take home and use on your own, not outside of the therapy session. Music therapy can enhance your awareness of yourself and your environment and those around you. It provides an alternative way of expressing yourself verbally and non-verbally. Not everything we do in a music therapy session is talk. Not everything we do is music. Sometimes there's a combination of both. So for those folks who are looking for a different way to communicate or a different way to express themselves, music therapy can be a really great opportunity. Music therapy can help develop coping and relaxation skills that you may not already have kind of in your toolbox. It supports healthy feelings, positive thoughts. It can improve your problem solving skills and improve your interactions with other people, as well as your concentration and attention span. Both of those things are affected by depression and anxiety. So hopefully you found this really helpful. If you have further questions for me, please feel free to comment on this video or follow the link to my website. My contact information is there. I'm leaving my phone number and website address on this video, so feel free to give me a call. I'm always happy to answer your questions. And I hope you have a wonderful day. Thanks for watching. Bye-bye.